Vascular disease is any abnormality involving either the arteries or the veins in our body. The arteries and veins are the blood vessels that carry blood to and from the heart. When we talk about vascular disease, a lot of times we focus on the arteries, which are carrying blood flow from the heart to all the different parts of our body. The main two types of vascular disease involving the arteries is either an area of narrowing of the artery. The areas of narrowing are typically caused by plaque that's building up within inside the artery. Unfortunately, this can affect arteries going to all the different parts of our body, to our heart, arteries going to our brain, arteries going to our kidneys, and to our extremities. And wherever the blockage is at can limit blood flow, can lead to heart attack, stroke, problems with kidney function, and pain in your legs with walking. The other aspect of arterial vascular disease is formation of aneurysms. Aneurysms are where the arteries dilate in size. As these arteries get bigger in size, there's a risk that they can rupture. If those arteries rupture, most people don't survive. Most people bleed to death. There are certain types of vascular disease that can cause symptoms. When vascular disease involves the legs, patients can have pain with walking a certain distance. Sometimes it will lead to sores developing on the feet. Sometimes patients can have symptoms of a stroke that lead to vascular disease or heart attack. Unfortunately, a lot of patients with vascular disease don't have symptoms until they have a catastrophic event. One of the vascular disease is a formation of aneurysms, where the arteries dilate. The most common location for that is of the abdominal aorta. That unfortunately these patients tend to not have any symptoms, and so they can be detected by other x-rays or ultrasounds for some other problem. The patients who would benefit from intervention or treatment of aneurysms are those where the aneurysm grows in size. The risk of aneurysms is that the aneurysm can rupture. Unfortunately, if the aneurysm ruptures, most people bleed to death. And so it is best to treat these before it has a chance to rupture. The risk of rupture goes up with the increasing size of an aneurysm. We typically recommend fixing aneurysms if that aneurysm gets to bigger than 5 centimeters in diameter. There are two main methods of treating aneurysms when it becomes big enough to be large enough in size to be treated. The first is with an open aneurysm repair, where we make an incision on the abdomen. We actually go in and replace that aneurysm with an artificial graft. That graft is actually sewn in position. It's about a week stay in the hospital. Most people take about 6 weeks to 2 months to really recuperate to normal activity. So the other option is an endovascular repair, which is a much less invasive repair. At least half of the patients, if not up to 60 to 70% of the patients, can have an endovascular repair as opposed to the traditional open repair. The benefit of an endovascular repair is, instead of making a large incision on the belly to expose the aneurysm, we make very small incisions over the arteries in the groin, bring a graft up from the inside of the artery to seal that aneurysm from the inside. Because it's less invasive, it's less pain at the time of surgery. Most patients can get out of the hospital within a day of surgery and back to regular activity within 1 to 2 weeks of surgery. Also, it's less risky because there's a lower risk of significant blood loss and problems with the heart and lungs. In general, there's between open or endovascular aneurysm repair, they have very similar long-term outcomes. Now, the price that you pay for doing an endovascular aneurysm repair is that we have to monitor that for the rest of your life. We have you come back for routine CT scans or ultrasounds to monitor that, usually once or twice a year. As long as the graft is in good position and the aneurysm is shrinking appropriately, no other treatment is indicated. In approximately 3% of patients, other intervention may be required at some point down the road. Shawnee Mission Medical Center has a lot of the high-end equipment that is required to do endovascular aneurysm repair. It requires special x-ray equipment as well as special tables that the patient is lying on during surgery, so that we get the optimum images so that we can do all the modern techniques in excluding these aneurysms with an endovascular graft. In addition, we need very good quality images before the aneurysm repair with CT scans so that we actually can measure the graft graft that has to be implanted during the surgery to successfully exclude the aneurysm. Because abdominal aortic aneurysms in general do not cause any symptoms before they can be a catastrophic event, most of these either picked up by incidental x-rays or ultrasounds. Patients who are at risk for aneurysms are those patients who are over 65 years of age, have history of smoking, high blood pressure, or definitely a family history of aneurysms. If you have any of those criteria, it is good to have a screening. Screening can be done by an abdominal ultrasound. There are no risks of ultrasound. It's relatively low cost, and it is very good at detecting aneurysms. This can prompt treatment before a catastrophic event can happen. To prevent vascular disease, the key elements are to stop smoking, to control blood pressure, if you have diabetes, to control blood sugar, and to exercise in general to help your heart and lung health. There are other things such as controlling cholesterol, lowering cholesterol. Certain cholesterol lowering medicines can also either decrease the formation of plaque buildup. With aneurysms in general, the only two things that we know about that can decrease the risk that aneurysms will grow in size is to stop smoking and control blood pressure. There are some experiments going on to see if certain medications can help, but there's no data right now to suggest that. Surgery is never a pleasant thing to undergo. Unfortunately, it is a necessary thing for certain patients. Because of that, it is best to have a very empathetic support staff, including preoperative assessment, intraoperative care, and postoperative nursing care. Shawnee Mission does an excellent job in having empathetic nurses as well as high-tech equipment to make an unpleasant treatment as pleasant as possible. Vascular disease is a very prevalent problem. Approximately 20% of patients over the age of 65 have a form of vascular disease. The exciting thing is that as time goes by, we have new innovative technologies to treat vascular disease, and these technologies tend to be less invasive and more broad spread in how they can be applied. If there's a concern for vascular disease, I'd encourage you to talk to your primary care physician to see what type of screening studies would be appropriate to you. My name is Kirk Hance. I'm a vascular surgeon working with Shawnee Mission Medical Center.